In this video, I'm going to go over what a stroke or what a CVA is, what causes them, the symptoms, and what you can do if someone or you are suffering from one. So what is a stroke? So scientifically, the term for stroke is a cerebrovascular accident. And the word cerebro here basically hints at a stroke affecting the brain. And a stroke usually affects one side or one hemisphere of the brain, so that being either the right or the left hemisphere. And this can be due to two reasons. So it can be either from a blood blockage, so one of the blood vessels that deliver oxygen to your brain gets like blocked, or it can be because one of the blood vessels burst. So causes or types. So there's three sort of types of strokes, or you can categorize strokes into three different categories. So first there's the blocked artery. So this is called an ischemic stroke. It can happen due to like a plaque buildup. A way to avoid this is having just overall living a healthy lifestyle, so not eating any foods that has heavy fat content, heavy cholesterol content, or heavy trans fat content. And another one is a bursted vessel. So this is called a hemorrhagic stroke, and this can be caused by a head trauma. So for example, if you get in a car accident or a sports accident that causes head trauma, or it can be caused by hypertension. This is when high blood pressure or someone with high blood pressure can form like a blood clot in the brain, which can lead to a bursting and thus causing a stroke. And the third one is a TIA, or you can think of it as a temporary blockage. And this usually has no lasting symptoms. But again, it is very important that even if like the person, whether that be you or someone that's with you, suffers from a TIA, so no lasting symptoms, so the symptoms go away after a while, it is still very important to get it checked out by a medical professional. So here, onto the symptoms. So the main symptoms would be sudden numbness on one side of the body. So that could be one side of your face goes numb, or one arm or one leg on one side of your body. And on the right, here's like a little diagram of what that may look like on the face. So as you can see here, on this side of the face, it's sort of like drooping down. And that can be an indication of a stroke, as it only affects like one side. As you can see, in this case, it's right side of the body. A good test you can do with someone is ask them to smile, and if you see only one side of their body or one side like smile and one side still drooping down, that's a good indication that they're suffering from a stroke. Another symptom is troubled speaking, so they can be slurring together their words, or their words come out really garbled. And again, a good test for this is asking them to say something to you, and if they say it in a really non-cohesive sense, then that could be an indication of a stroke. And the third symptom is trouble walking, so this can be due to sudden dizziness or just sudden uncoordinated like movements. So finally, what can you do? So as you can see here on the right, there's another sort of like the symptoms we talked about, and there's an acronym that goes with them. So it's called FAST. So F stands for face. So as we mentioned before, one side of the face kind of droops down, and you can look for uneven smiles. So ask them to smile, and if one side still droops down, that's an indication of a stroke. A is for arm. So check if one arm is weak. So this can be done by asking the person you're with to lift both arms in the air. And if one arm isn't really going up or is having trouble lifting in the air, then that could be a sign for stroke. S for speech, again, garbled or slurred together words is an indication of stroke. And finally, T is for time. So call 911 as soon as possible, or as soon as you recognize these symptoms of a stroke. And note the time if possible when symptoms appear, as this can help the medical personnel to recognize or deliver the best treatment option. And it's very critical to not give or not eat or consume any food, drinks, or medication while you or someone else is having a stroke, as that can worsen the symptoms or worsen the condition you or someone else is in. And finally, as a last resort, if for some reason 911 cannot reach you, or they for some reason cannot send an ambulance to you, then drive to the hospital. But this is only to do as a last resort, as contacting 911 would usually be faster and than driving to a hospital by yourself. All right, so thank you for listening. If you have any questions, please, feel free to leave them in the comments. I'll do my best to answer them.